It's very hard to conceive when you drive around in sunny Florida. Things look normal. There's a few people wearing masks. But it's only when you step into the ICU environment and you realize how many people are dying from this disease and are in critical condition fighting for their lives when this becomes real. And it's so important for me to show that to you. The patient in this room has been on such high pressures for mechanical ventilation that she's developed air leaking out of her lungs into her chest wall, just as a result of the high pressures that we've had to give her on the ventilator in order to get the amount of oxygen she needs to survive. I want you to tell you the story of this patient. On Monday, I started my day at 6:30 in the morning. At 10:30, we were on this floor when the cardiac arrest code blue call came overhead. We all then had to run from this floor up to the 7th floor, which is our ICU alternative geography. CPR, chest compressions, was underway when we got there. We had to stand outside the room, get our personal protective equipment on while watching the CPR in place. As a provider, it's extremely difficult watching a patient who needs your help, but you have to take your time and get the personal protective on. That's a challenge mentally and emotionally to stand by and to force yourself to protect yourself before going into the room. We went into the room, we resuscitated the patient. His heart was not beating for about 5 minutes before we were able to get him back. We put him on a mechanical ventilator, and the day was filled with many more admissions and many more code blues. The first chance that I had to phone his family, who was called before his deterioration to say that he was going on life support, was at about 6:45 that evening. The degree of devastation this disease is bringing to our community cannot be explained in words. It's so hard for us as healthcare providers to witness the suffering of our patients and their families from this deadly virus. And I ask every one of you to do what you can to prevent the spread of this deadly disease. Do not underestimate this disease. Do not let it come into your lives and shatter your lives and that of your family. Wear masks whenever you're out in public, whenever you're interacting with any other human being, even if it's someone that you think you know. Wash your hands rigorously and vigorously multiple times a day. It's so important for you to keep safe as a community. Please look after yourself.